Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
The March issue of the IJD focuses on conditions and care pathways that implicate individuals in underserved populations. In settings of displacement, homelessness, incarceration, and geographic isolation, delayed presentation and disrupted follow-up are compounded by legal, language, privacy, diagnostic, and workforce constraints. The highlighted papers pair epidemiology with implementable responses, outreach and screening, improved correctional access, culturally informed care, and point-of-care, resistance-aware gonorrhea management. The featured papers offer practical solutions spanning outreach, improved correctional access, culturally grounded care, and diagnostic and treatment pathways for underserved populations. Together, these contributions show that closing the equity gap requires both clinical innovation and health system design that meets people where they are.
We begin with a viewpoint by Donovan et al., which proposes a new framework for understanding hair-driven medical decisions. This article proposes the Hair First Groups framework, identifying 5 categories of patients who prioritize hair preservation over conventional medical recommendations, including refusing cancer treatment, altering reproductive decisions, avoiding surgery, discontinuing medications, and foregoing weight loss therapies. The author argues these choices reflect deep psychological connections between hair, identity, and self-worth, rather than mere vanity. More research and clinical awareness are needed to better recognize and support these patients within shared decision-making frameworks.
On the theme of underserved and vulnerable populations, we turn to a narrative review by Tanisov et al. On gonorrhea management across various resource settings. Gonorrhea, a common sexually transmitted infection caused by Neisseria gonorrhoeae, represents an escalating global public health threat due to antimicrobial resistance. The current review explores diverse approaches around the globe to gonorrhea management across various settings, with a focus on diagnostic strategies, treatment practices, resistance surveillance, and new trends, such as point-of-care tests or doxycycline post-exposure prophylaxis. High-resource settings benefit from proper infrastructure, advanced diagnostics, screening programs, surveillance, access to effective treatment, and test-of-cure protocols. Nonetheless, rising incidence and resistance rates persist. In contrast, limited resource settings often depend on syndromic management, which lacks sensitivity and fails to identify asymptomatic infections. The low diagnostic capacity and poor access to resistance-guided therapy contribute to inappropriate antimicrobial use. Migrants, incarcerated individuals, and those in vulnerable contexts face additional barriers. These disparities undermine the global control efforts and enable the emergence of drug-resistant strains. Addressing these gaps requires a multifaceted, equity-focused approach, strengthening diagnostic capacity, expanding access to molecular testing and surveillance, tailored interventions for the local context, and promoting antibiotic stewardship in both policy and practice.
Next, we highlight a narrative review by Kormos et al. On a rare and complex dermatologic condition. Grzybowiski's generalized eruptive keratoacanthoma, also known as GEKA, is a rare variant of keratoacanthomas, characterized by hundreds to thousands of lesions accompanied by pruritus, mucosal involvement, and comorbidities. This study aimed to analyze the clinical presentation, associated comorbidities, treatment strategies, and outcomes of GEKA. The authors conducted a literature review of all published cases between 1950 and 2024. A total of 143 articles were screened. 58 were included, yielding 64 cases. Of these, 24 were associated with severe comorbidities, while 40 were not. Cases without associated conditions were more likely to exhibit a worse prognosis, greater therapeutic resistance, and distinct clinical features. In contrast, cases associated with malignancy, systemic diseases, or other comorbidities tended to show better treatment responses and fewer complications. Pruritus remained the predominant symptom in both groups, with similar lesion morphology. The rarity of GEKA leads to a paucity of literature. Reporting bias in limited cases may lead to less generalizability. Based on our review and considering the differences in clinical presentation, demographics, associated comorbidities, complications, and prognosis, GEKA may be classified as primary or secondary to a malignancy, systemic disease, or other comorbidity, encouraging clinicians to have a high index of suspicion during evaluation and treatment for an underlying trigger.
We now turn to a systematic review and meta-analysis by Pala et al., examining the dermatologic features of endocrine tumor syndromes. Endocrine tumor syndromes including multiple endocrine neoplasia types, 1, 2A, and 2B, Carney complex or CNC, and PTEN, hamartoma tumor syndrome or PHTS, are hereditary conditions characterized by multi-system tumor development. Alongside endocrine neoplasms, these syndromes present with diverse cutaneous manifestations, offering valuable diagnostic clues for early recognition and management. This systematic review and meta-analysis aim to evaluate and synthesize the dermatologic features associated with these syndromes. Following PRISMA 2020 guidelines, a systematic search of Medline, Cochrane Library, and Embase databases was conducted. Eligible publications included original articles, case reports, and case series with detailed dermatological descriptions of patients with the aforementioned syndromes. Data extraction and risk of bias assessment were performed independently by multiple reviewers. Statistical analyses and data visualization were conducted using Program Package ER. A total of 217 studies comprising 833 patients were included: 276 MEN1, 48 MEN2A, 9 MEN2B, 121 CNC, and 452 PHTS cases. Distinct dermatologic patterns emerged within each syndrome: angiofibromas, collagenomas, and lipomas in MEN1, cutaneous lichen amyloidosis in MEN2A, mucosal neuromas in MEN2B, lentiginosis and cutaneous myxomas in CNC, and tricholipomas, papillomatous papules, and acral keratoses in PHTS. Melanoma prevalence was 2.2% in PHTS and 2.5% in MEN1 patients, underscoring the need for dermatologic vigilance. This review highlights the role of dermatologic assessment in identifying endocrine tumor syndromes, with cutaneous findings often serving as early accessible markers of systemic disease. Enhanced awareness of these manifestations can facilitate timely genetic evaluation, cancer surveillance, and multidisciplinary intervention.
Returning to the topic of hair loss, we look at an original article by Law et al. On patient-reported outcomes in alopecia areata. Using the alopecia areata patient priority outcomes measure, this study evaluated patient-reported improvements in emotional symptoms such as self-consciousness, embarrassment, sadness, frustration, and activity limitations, including outdoor activity, exercise, interactions with others due to hair loss among patients with alopecia areata who participated in a randomized controlled trial of ritlecitinib. By trial week 48, participants receiving 50 mg ritlecitinib plus or minus 200 mg 4-week loading dose reported greater improvements in emotional symptoms and activity limitations due to hair loss than did participants receiving subtherapeutic 10 mg ritlecitinib. The findings indicate that patients with alopecia areata may experience improvement in psychosocial burden following hair regrowth with ritlecitinib.
Further, in this month's original research, Shaw et al. Present a genetic study exploring the overlap between psoriasis and Crohn's disease. Psoriasis and Crohn's disease are chronic immune-mediated inflammatory diseases with overlapping immunologic mechanisms. Although comorbidity is rare, epidemiologic and genetic studies have highlighted a significant association between psoriasis and Crohn's disease. We performed a focused exome-wide association study comparing individuals with comorbid psoriasis and Crohn's disease to healthy controls, and to individuals with psoriasis or Crohn's disease alone in the UK Biobank, and performed validation analyses in the All of Us research program. The exonic architecture of comorbid psoriasis and Crohn's disease more closely resembles that of psoriasis alone. 3 protein coding variants, including 2 putatively functional variants and 1 proxy variant, were significantly associated with comorbidity. A missense variant in HLA-C, a missense variant in CFB, and a synonymous variant in TAP2. A significantly greater proportion of individuals with comorbid disease harbored at least 1 risk variant in all 3 genes compared to controls and psoriasis-only individuals in both the UKB and the AOU. This study identifies novel, exonic, protein coding genetic variation associated with the comorbidity of psoriasis and Crohn's disease, in addition to identifying an association between the combined carriage of 3 risk variants with comorbid disease compared to controls in psoriasis alone in multiple datasets. These risk variants may serve as prognostic biomarkers and guide personalized biologic treatment strategies in affected individuals.
We now turn to short-format research articles. First, Chen et al. Report on the mental health burden of seborrheic dermatitis. This systematic review and meta-analysis examined mental health symptoms in patients with seborrheic dermatitis, finding that roughly 1 in 5 patients experienced depression, 21%, or anxiety, 19% symptoms, across 15 studies involving over 12,000 patients. These rates are comparable to those seen in other chronic inflammatory skin conditions like atopic dermatitis and acne vulgaris, suggesting seborrheic dermatitis carries a similarly significant psychological burden. The authors note limitations including inconsistent assessment tools and lack of control groups, and call for routine mental health screening and future research into the mechanisms linking seborrheic dermatitis and mental health.
Next, Comprenciotis et al. Examine the use of omalizumab during pregnancy in a short communication. This systematic review examined the safety and efficacy of omalizumab use during pregnancy in women with chronic spontaneous urticaria, identifying 12 eligible studies reporting on 67 pregnant women treated with the drug. The available evidence was generally reassuring, with only 1 miscarriage and 1 fetal anomaly reported, no major pregnancy complications, and good to complete disease control achieved in patients who continued treatment. However, the authors caution that the findings are limited by small sample sizes, reliance on case reports and retrospective studies, and inconsistent outcome reporting, emphasizing the need for well-designed prospective studies before definitive conclusions can be drawn.
Verma et al. Contribute a short communication on an emerging syndrome and its psychiatric comorbidities. This large-scale propensity-matched analysis using the Trinex database found statistically significant associations between VEXAS syndrome and all substance use disorders examined, including tobacco, alcohol, opioids, cannabis, and cocaine, with opioid abuse showing the strongest association. The authors suggest these findings may reflect bidirectional interactions between VEXAS-related immune dysregulation and substance use, where elevated cytokines worsen neuropsychiatric symptoms and substances in turn further amplify inflammation. Key limitations include the lack of a dedicated ICD-10 code for VEXAS, potentially introducing misclassification, a patient demographic inconsistent with the syndrome's known X-linked male predominance, and a retrospective design that precludes causal conclusions.
In another short communication, Scarfi et al. Report on a surgical approach to a rare skin tumor. Eccrine porocarcinoma is a rare, aggressive, malignant adnexal tumor, and this retrospective study evaluated the Tübingen-Tort technique, a Mohs derivative micrographic surgery offering 100% margin assessment, in 16 eccrine porocarcinoma patients treated across 2 Italian centers between 2021 and 2024. With a mean follow-up of 25 months, the study reported a 0% local recurrence rate and no lymph node or distant metastases. The authors conclude that the Tübingen-Tort technique is a promising alternative to traditional Mohs surgery for eccrine porocarcinoma, offering comparable oncologic outcomes with greater time efficiency and a more accessible learning curve, though the small sample size and lack of randomization limit definitive conclusions.
Smith et al. Offer a short communication on the relationship between psoriasis treatment, weight, and lifestyle. This cross-sectional survey of 96 biologic-treated psoriasis patients found that while biologic therapy improved motivation for healthy eating and exercise, significant barriers including life stress, time constraints, and financial pressures continued to impede meaningful lifestyle change. Although most patients recognize the link between obesity and cardiovascular risk, only half understood that obesity could diminish biologic treatment response, highlighting an important educational gap. The authors conclude that a multidisciplinary approach integrating lifestyle counseling alongside pharmacologic therapy is essential, given that BMI often remains unchanged despite substantial skin clearance with biologics.
Further, Fosu et al. Explore the use of artificial intelligence in diagnosing a challenging ulcerative condition. This study developed a machine learning model using Google's Teachable machine, trained on 200 images to distinguish pyoderma gangrenosum from similar ulcerative conditions, achieving 73.2% accuracy, which was comparable to dermatologists' 76.1% and superior to internal medicine and family medicine physicians. The model showed statistically significant advantages over family medicine physicians across all performance metrics and over internal medicine physicians in specificity, suggesting potential utility as a point-of-care diagnostic aid, particularly in settings with limited dermatology access. The authors acknowledge key limitations, including small sample size, inconsistent image quality, and non-blinded physician cohorts, and call for future studies using larger, standardized, and diverse datasets to improve model robustness and equity across skin tones.
Finally, Nguyen et al. Close out the issue with a short communication on over-the-counter hair loss supplements. This study surveyed 39 top-selling saw palmetto extract supplements across 5 major online retailers, finding wide variability in recommended dosages, 54 milligrams to 3,600 milligrams, inconsistent safety information, and that only 12.8% of products disclose potential adverse effects, none of which mention serious risks like hepatotoxicity, pancreatitis, or bleeding. While saw palmetto extract is commonly purchased for prostate health, 79.5%, and hair loss, 25.6%, due to its 5-alpha reductase inhibiting properties, it remains an unregulated dietary supplement, exempt from the rigorous testing required of prescription alternatives like finasteride. The authors conclude that this regulatory gap leaves consumers inadequately informed about potential risks and call for more standardized dosing guidelines and prospective clinical trials to better establish saw palmetto extract's safety and efficacy.
This was IJD in Focus, our monthly overview of open access articles. Thank you for listening. Until next time.